Sleep apnea is a breathing disorder that affects 6% to 8% of the population. There are two main types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea, or OSA, is more common than central sleep apnea and is characterized by breathing interruptions during sleep due to a collapsed or obstructed upper airway. Because sleep apnea results in a decreased amount of oxygen in the brain and body, sleep apnea is a serious, potentially life-threatening condition. Your risk of obstructive sleep apnea can be increased by a number of factors, including obesity, advanced age, smoking, alcohol use, the use of sedative hypnotics like sleeping pills, nasal congestion, a large neck size, a large tongue, or enlarged tonsils and adenoids. Men are twice as likely as women to have sleep apnea. Because sleep apnea causes interruptions in your breathing, it can also result in a number of other symptoms. If you suffer from sleep apnea, you may experience symptoms like frequent snoring, morning headaches, gasping or choking during sleep, clouded memory, excessive daytime drowsiness, irritability and personality changes, and fragmented, non-refreshing sleep. When not properly treated, sleep apnea can contribute to a number of serious health problems as well, including high blood pressure, fatigue, weight gain, stroke, diabetes, depression, liver problems, heart failure, memory loss, and heart disease. Because sleep apnea is a potentially serious condition, it is important to properly treat it. For children with sleep apnea, a tonsillectomy performed by a doctor is often the primary treatment method. If that is not sufficient, your doctor may recommend an upper arch expansion. For adults, a number of treatment options are available. Common treatments for obstructive sleep apnea may include oral appliances, continuous positive airway pressure devices, or CPAP, expiratory positive airway pressure devices, or EPAP, adjustable continuous airway pressure devices, or APAP, or surgery, which is often aimed at removing excessive tissue or repositioning the jaw. The goal of each of these treatments is to allow you to breathe continuously as you sleep. An oral appliance is a small custom-made mouthpiece that is used to treat obstructive sleep apnea. This oral appliance is designed to fit over your teeth and be worn while you sleep, keeping your airway open so you can breathe continuously. An oral appliance may be appropriate if you suffer from mild to moderate obstructive sleep apnea. CPAP, or continuous positive airway pressure therapy, uses a machine to increase air pressure in your throat while you sleep so that your airway does not collapse. EPAP, or expiratory positive airway pressure therapy, creates pressure during exhalation to stabilize the airway. APAP, or adjustable continuous airway pressure therapy, adjusts the pressure to the optimal level to maintain an open airway. Surgery may be recommended if less invasive treatment methods do not produce satisfactory results. Sleep apnea surgery usually focuses on enlarging the airway by removing soft tissues or expanding the jaw structures to eliminate restrictions in the airway. Your doctor will help you determine which treatment method is best suited to your personal needs and preferences. To learn more about sleep apnea and treatment options, please contact your doctor.